Hi, I'm Dr. Tracy, and your dog was spayed today. So spay is the term that we use with female dogs when we remove their entire uterus and their ovaries, so an ovarohysterectomy. You may also see it abbreviated as OHE. So we do have some special take-home instructions for you. Some of these are specific to the actual spay and the incision, and some of them are generic instructions that have to do with general anesthesia. So we're going to send you home a little sheet that you can read everything. You can hang it on your refrigerator for reference, but I'm going to still go over it with you. So the first things that we want you to watch for are loss of appetite for more than 2 days, severe depression and weakness, vomiting after the first 24 hours. Those are all things that are related to general anesthesia. It is normal for your dog not to be hungry after surgery. A lot of times those drugs are in their system for up to 24 hours. That's why with people, they say that you can't operate large machinery for 24 hours because those drugs are still in your system. So, but if they don't eat after a day or two, we need to know about it. Another common complication is the medications can actually cause some diarrhea. They can get a stress colitis. We need to know if your dog is having diarrhea or you see blood in their stool or vomiting. As far as their incision, you need to watch for incision drainage, swelling, redness of the actual incision. And I would get in the habit of just looking at that every single day so you can see the changes from day to day. And then, of course, watch to make sure that your dog is not licking that incision or chewing on them. We do have Elizabethan collars, cones, the cone of shame to go home. You can be attached to the collar or with a shoelace. Not every dog needs this. Most people know if their dogs are the type of licky dogs or the type of dogs that can't leave an incision alone, and then you're going to want to ask for one of these. But often we don't have problems. For whatever reason, it seems like it's more of an issue with boy dogs than girl dogs. So let the technician know at discharge if you think you're going to need one of those. As far as diet, what to feed your pet after surgery, their regular dog food is fine. We recommend that you do half of a meal in the evening when your dog is wide awake. And if they eat that half a meal, that's great. The next morning, they can have regular food. Water should be available at all times. If they seem really hungry, don't overfeed them. A lot of times that can initiate vomiting. If your dog doesn't eat, no big deal. Activity, restrict exercise. This is the toughest thing and it's so important. Restrict exercise, no running or jumping. If you have a dog that bolts up and down stairs, sorry about the page, you're going to want to actually put a leash on them going up and down stairs too so that they don't bolt. Usually the dogs feel pretty groggy for the first day or two, and having just a little bit of discomfort slows them down. But on day 3, a lot of times they are ready to go. They want to play. They want to run around. That's where you really need to watch, is day 3, 4, and 5. Walks are fine. Leash walking on level ground where your dog is walking and doing easy trotting, that's totally fine after surgery for a few days. Just no free running. Medications. We send every dog home with pain medications. We use different medications based on their size and based on how the surgery went. You'll have specific instructions that will be actually on the label. Now, usually they don't need any medicine until the morning after surgery because we give a 24-hour dose prior to their surgery. And of course, most dogs we put incisions, or we put stitches in, skin stitches. Now there are a lot of vet clinics that don't. They do all their stitches under the skin. The reason we put stitches in the skin is because we want to see your pet back. We want to make sure it healed. We want to make sure that they have not lost weight, that they're feeling good, and that's a great way for us to recheck your pet. And there's no cost for that. It doesn't cost any extra money at all. Now, one thing we often do too is we spray a little silver spray on their incision. It's very bling. But the nice thing about that is it actually seals the incision like a liquid bandage. But if your dog is licking, the silver disappears. So in 24 hours, if your dog's incision is licked clean and there's no silver left, you're gonna know they need a cone. So the last thing that isn't quite as urgent, but I want to bring it up, is we actually removed an organ from your dog. So when you take away an organ, they need less calories. We know that hormones are extremely important to our metabolism. So once your pet is spayed, their metabolism tends to go down. They don't need as many calories. You just need to be proactive. In this day, we see way more obese dogs than we see skinny dogs. And honestly, being overweight is just as detrimental to their health as being underfed and starving a dog. So it's very important, especially if you're feeding a premium food, which we encourage, to not overfeed them. So we can give you guidance on that. You're always welcome to come in year-round at any time and weigh your dog so you know what they weigh to make sure they're not gaining too much. Our technicians and our receptionists are very knowledgeable on body condition. So just be very conscious of the treats and the food that your pet gets. And of course, one of the best ways to prevent that is plenty of exercise. So Alyssa, am I forgetting anything about post-op spays?
I don't think so.
All right, well, that's what you need to know. You are always welcome to call 24 hours a day, 7 days a week. If you have a question about your pet, we will answer the phone unless we are actually physically working on another animal. If it's 10 o'clock at night the day after your dog was spayed and you're worried something's not right, please call.